And finally, Mr. President, I'm also here today to talk about the passage of an incredibly important bill that will aid individuals, families, and communities confronting an epidemic that is overwhelming our country. This isn't the first time that I've been talking about the opioid epidemic, and unfortunately, it likely won't be my last, but I am happy to say that today's remarks will highlight some very good news. As part of a coordinated effort with 4 other committees, the Senate Finance Committee's package will be voted on tonight as part of the Opioid Crisis Response Act. But before I get to what is in that bill, I want to give some details of the unfortunate reality our country is facing. Last year, more than 72,000 Americans died from a drug overdose. The majority of these overdoses involved prescription opioids or illicit opioids like heroin or fentanyl. I've spoken to many families who have witnessed the devastating effects of these addictions firsthand, and I have been sadly impressed by the pervasiveness of this rampant epidemic. Truly, I promise you that you have more friends, family, and coworkers who have been affected by this epidemic than you probably realize. My home state of Utah continues to be hard hit by this crisis. An alarming number of Utahns have undergone hospital stays and emergency room visits due to opioid overdoses. In 2017 alone, over 450 Utahns died from an opioid overdose. As you may notice, Mr. President, Congress has recognized this problem for some time. And while this package is a significant step forward, it isn't the first thing we've done, nor will it be the last thing we do. Take, for example, the Bipartisan Family First Prevention Services Act, which was enacted earlier this year in February. Our committee also worked together to realize a 10-year extension of the Children's Health Insurance Program, which, as a part of its mission, helps moms, babies, children, and teenagers struggling with addiction or its impacts on families across the country. Our work did not stop there. We proceeded to work on ways that our committee, with its jurisdiction over Medicaid, Medicare, Family Services, and Customs, could work to improve the lives of the millions of Americans who have been devastated by this devastating epidemic. Mr. President, there are simply too many pieces of this bill to cover them all in one speech, but I'd like to give some highlights. The bill will make a real difference in Medicare, a program in which 1 in 3 beneficiaries is prescribed an opioid. It will empower patients through information on pain treatment alternatives. It will expand treatment options for patients suffering from addiction, including through increased access to care via telehealth and a pilot program that will allow Medicare to cover methadone and wraparound services to treat addiction for the first time. The bill also increases the ability to track opioid prescriptions to prevent misuse and diversion, while also ensuring beneficiaries promptly get the medications they need. We know many children are in foster care as a result of the opioid epidemic, and this bill supports programs that will help parents complete treatment for opioid addictions and reunite with their children more quickly. It will also increase the availability of family residential treatment programs, allowing more parents to receive help while still caring for their children in a supervised setting. For the first time since Medicaid became law in 1965, pregnant women can receive Medicaid coverage for prenatal and postnatal care while seeking treatment at institutions for mental disease. New and improved prescription drug monitoring programs allow states to better understand the full scope of an individual's prescription use across payments and insurers. This bill brings that data into the hands of providers and insurance plans to help them develop care plans for those with substance abuse disorders. And of course, let me just say that additionally, this package is not limited to fixes in the healthcare space. We also worked with Senator Portman to craft the bipartisan STOP Act, which has also been incorporated into this package. That bill sets new requirements for the United States Postal Service to obtain advanced electronic data that allows for U.S. Customs and Border Protection to effectively target and stop fentanyl and other illegal substances from entering the country through our postal system. Getting our law enforcement this additional data will bolster efforts to stop dangerous opioids at the border and to keep them away from American families. In short, Mr. President, the Finance Committee's portion of this larger effort is an important step forward, but it is made that much more meaningful given the wide-ranging provisions included from the Judiciary Committee, from the Judiciary, Commerce, Banking, and Health Committees. Together, this bill will provide the resources, capacities, and direction to state, local, and federal governments to better assist those who are in such great need right now. Additionally, I want to thank the leader, the chairman, the ranking members, and all other members of the 4 other committees that have been involved in this great undertaking. There has been no shortage of effort or genuine concern from both sides of the aisle to address this painful issue that has hurt so many American families. I appreciate this bipartisan push to create a successful place for a piece of legislation. And I think this bill represents Congress at its best. I encourage all of my friends on both sides of the aisle to vote for this important piece of legislation tonight. And I look forward to working with my colleagues in the House to advance a bill that addresses the opioid epidemic to the President's desk.